for example, we're talking a lot about falls and how falls and osteoporosis kind of have this relationship because the fracture happens as a consequence of the fall. And fear of falling is an independent risk factor for falling, so or for falling again. And so I always find it, and I don't know if we really know the answer. I think we're always trying to figure out the art of it. But what I always find challenging is like, how do we acknowledge people's risks, understand their risk factors that gives them this sense of informed consent and kind of empowerment about where their health status is without creating the fear, because when people start having, oh my gosh, if I fall, I'm going to fracture, then it can create this fear of falling that causes this stiffening behavior, changes in gait mechanics, less sensory integration, more impairment in navigational planning, like all these things that we see in the cascade of fear of falling that subsequently becomes this risk factor. So I just think it's such a an interesting conversation, and I know that there has been conversations that I've had that have gone well, and I sure that there are plenty of conversations that I've had that did not go the way I wanted them to, just based on how I'm communicating with patients.
Yeah, it's really tricky. And I find, and I guess in my work, I'm often getting questions from people about specific activities. So I guess it depends on what they're asking about. So if they're not asking you like, what is my risk or what is that like, and they can't really, because you can't diagnose and you can't tell them your probability of fracture is this, like that's not your scope of practice, right? So I think you acknowledge that the risk is there. So you can say, yeah, when your bone, there's two things that contribute to fractures. One is, your bone strength is low. And the other is the loads that you apply to bones are higher than what they can withstand. So if you have a car accident, you may fracture even if your bones are normal. So there's two things that we can influence. Your bone strength is lower than, is lower, and it might put you at increased risk, right? So we know this. And we're going to do whatever you have to do, all the things you can to make sure that you're not losing more bone. So what are the things you can do? You can consider medication. You can make sure you're getting enough calcium, vitamin D, and calories, that you're not losing weight, because when you lose weight, you lose muscle, bone, and fat, right? And you can do the types of exercise that can help you maintain or potentially increase your bone mass. So those are things you can do about that. Now let's go on the other side. We want to avoid applied loads. So there's things that cause, your applied loads to your bone. So one is falls, but there's other things, the way you lift things and the way you move around, right? Because some people will fracture if they bend over to tie their shoes if their bone density is low enough, right?